The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with our wonderful Project Independence and You hosting team of Otto Lohse. Good morning, Otto. How are you?
Good morning, Rebecca. Always a pleasure to be with you.
It's always a pleasure to co-host with you. And Kristina, who of course is our radio show producer and also the Director of Senior Citizens at Project Independence and Department of Services for the Aging for the town of North Hempstead. And our fabulous guest today, who is, I think you're like the most requested, and every time you're on, people get very excited. So our guest today is Barry Klitsberg, and you're an Assistant Program Coordinator at Nassau County's HIICAP program. And we want to thank you so much for joining us today and talking about the Medicare 2023 updates and also open enrollment. So how are you, Barry?
I'm doing well. Thank you very much for having me on your show. It's always a pleasure to be here. The questions are always interesting, and we get into some very nice discussions.
Great. That's good to know.
That's the goal.
Yeah, that's the goal. So before we get into all the updates, we talked a little bit about this before the show started. I'm just curious because we hear so much about how many baby boomers are turning 65 every year. And this has been going on for many years until, I guess, the last year of 1964 or when those people turn 65. So what has that been like for Medicare? Because I don't think we've ever seen so many people hitting the age of 65 at once.
I wouldn't say it's a stress to the system, but the numbers are quite dramatic. About 10,000 people a day turn 65 now. So you have the baby boomers, as you rightly state, are applying. A lot of people are retiring too. But financially, it's not putting a stress on the system, even though the workload is greater. And I'm getting more and more calls from people who are turning 65 or retiring, wanting to know about what their options are and the best way to go about getting health insurance that works for them, which is our main function.
Right. So it's very interesting just because so 10,000 people a day, that's millions per year. And it's good to know that the system's going to be there and it's strong. So,
oh, absolutely. The system will be there. The actuaries keep changing the figures every year. There are probably going to be some changes in the next few years in order to fund the program, but that's up to Congress to do. I can talk about what is, but we can only speculate about what will be in terms of changes to the programs.
Barry, a lot of people we've talked over the years and we know a little more than most people, to be blunt about it. If you're new and you're just 65, how about just an overview of what your options are at that stage? You have whatever you have, you get your Social Security, and now you have to make a decision as far as insurance is concerned. What do I have to decide?
A couple of things. That's a great question. And a couple of things that are worth talking about at first. The first is, if you're 65 and you don't want to collect Social Security because you want to wait until you get a full retirement age or past that with your delayed retirement credits, but once you turn 65, you should apply for Medicare. The system a few years back, they separated Social Security and Medicare. It all goes through Social Security in terms of applying. But if you're not working and you're 65, you should apply for Medicare, even if you want to wait on your Social Security. That's the first thing. And if you're 65 and still working, you can hold off on applying for Medicare, especially the Part B part of the program, which has a premium, until you retire and then you can apply for Medicare without a penalty for late enrollment. So those are two of the basic things about applying. Now, once you are on Medicare, then you have a few different options of how do you receive your care.
Barry,
And I
just a
think,
quick question. I want to interject. So someone who's 65, when should they apply, though, for Medicare? Is it on their birthday? Is it 3 months before?
your initial enrollment period is 3 months before the month of your birth or your month of entitlement, the month of, and 3 months after. So if you're turning 65 in December, you can apply now, or you could have applied in September. Right? You could apply September, October, November is your 3 month prior, December, which is your month of entitlement, and January, February, and March are the 3 months after your date of entitlement. So you have a 7-month initial enrollment period. The only thing to remember is if you're born on the first of the month, your Medicare starts the first day of the previous month, because technically you've attained age 65 the day before your birthday, because then you start your 66th year. So people who are born on the first of the month revert back to the previous month.
Now, the only reason I could visualize somebody not applying for Medicare is if you happen to have really good insurance through some other source. Is that right? Or
Well, the other source would be through an employer group health plan if you're actively employed.
right?
If you're working and there's more than 20 employees at the company, or your spouse is working and you're covered under her plan, you can hold off on applying for Medicare until work ends or the coverage ends, whichever comes first. So if your spouse is working and you're covered under her plan, Medicare is secondary. So many people don't take Medicare Part B because they don't want to pay that premium for coverage
Right.
they're not going to use. So that's when you wait, and then you've got 8 months to apply for Medicare from the time your employment ends or the coverage ends.
Okay.
Mhm. Yeah.
Otherwise, you want to apply. I mean, there's a lot of benefits.
Absolutely. And if you don't apply when you're eligible, you might incur a late enrollment penalty, which is 10% a year for each year you're eligible and don't apply.
Hmm.
So you want to make sure you apply when you're eligible or when your employment ends.
So now you're eligible and you have Medicare Part A, Part B, Part D, which could be like speaking in a code to some people.
Yeah, well, I'm going to explain all that. All right. The Medicare Part A is your hospital insurance. That's premium free. There's no downside to applying at the time you're 65, because if nothing else, you show your Medicare card to the bus driver and you get on for half fare. Now, Part B has a premium. And I am happy to announce that for the first time since I've been working with the program, which goes back to the 70s, the Part B premium is going down. In 2022, it was $170.110. Next year, it's going to be $164.90. It's going down $5.20. Right, because of some technical reasons and miscalculations the previous year. And I don't like to use the word miscalculation, but there were updates in the data and the assumptions made by the actuaries. So the premium is actually going down. So between that and your Social Security check going up 8.7%, there's a big increase in the amount of money that seniors will get. Now, once you have your A and your B, now you've got some choices. You can take a drug plan, which is Part D, like you mentioned, and get your prescription coverage there. And you should do that when you're eligible for Medicare, unless you have other coverage, like even the VA or Medicaid, TRICARE, which is for military retirees. So there are other forms of coverage that could work. But that's Part D, D for drugs. And there's also something called Medicare Part C. And these are Medicare managed care plans. They're HMOs, health maintenance organizations, and preferred provider organizations, PPOs. And there are some positives and potential negatives for these. First, for the Medicare Advantage plans, the premiums tend to be low. So if you want to supplement, that might be a low-cost way to do it. And many of the plans cover other benefits besides drugs, like vision, dental, hearing, which Medicare doesn't cover. So there's some potential upsides to Medicare Advantage. There are some potential downsides, though. With an HMO, you must use the providers in the plan network. And you usually need a referral to see a specialist. If you go outside of the plan is not going to cover you, and Medicare won't cover you because Medicare is paying the plan to provide and pay for your services. So they're not going to pay twice. With a PPO, you don't need a referral to see a specialist, and you can go out of the network, but you've got a higher copay when you go. You still have coverage, right? But your copayments are a bit higher than if they were in the network. And these plans also frequently cover drugs, vision, dental, hearing. Some plans might have a fitness benefit. So there are some potential upsides. Also, you do need to check each plan to make sure your doctor's in it, and also to find out what would happen if you go into a hospital. Because unlike Medicare, these are not standard. So each plan has a different set of benefits, and you want to make sure that those benefits and potential costs work for you. Now, the other way to go, if you have traditional Medicare and a drug plan, is what's called Medigap. Medigap plans cover your Medicare cost sharing, either all or part. Those premiums are higher. There's no network of providers, though. Any Medicare provider, the Medigap plan will cover too. So if you go to a doctor who takes Medicare, your Medigap will automatically cover its share of that cost. So there are some goods and positives and negatives both ways. That's why people call our office to find out the details to see which way might be the best way to go. And if I can put in a plug, our office number is 516-485-3754. And you will get a counselor who can walk you through this.
Barry, is there or are there HIICAP offices like your offices for Nassau County, right?
Mm-hmm.
What about if you live in Suffolk County or you live in Connecticut or whatever? Is there a version of Barry, which I'm sure is not as good, but is there a version of Barry that's people in Connecticut? I have a friend of mine actually who asked me this question, and I really don't know the answer.
Well, actually, if you look at the back of the Medicare and You book, which you should have gotten about 10 days ago for 2023, there's a network called the SHIP Network, State Health Insurance Assistance Program. And on the back of the Medicare book is the SHIP phone number for your area. So the New York State number is in the back of the New York book. And if you call, they'll ask you your county and refer you to us. Every county in the state has a program. In New York, it's called HIICAP. Other states have different names, or it just might be SHIP. But every state has a program similar to mine. Connecticut's program is very good. I used to work with them a lot. There are some very good programs, but everybody in this is certified and trained. We also have to take confidentiality training because we do get private information. So we have to know what the rules are. But yes, your answer is absolutely, no matter where you are in the United States, there is a program.
That's great. I mean, it's hard for people to, as strange as this may sound, to accept the fact that they can get free guidance where somebody's not trying to sell you something. Most of the time when you get guidance, somebody's trying to sell you something, right?
That's true.
Yeah. And that's not the case here.
No, we have no affiliation with insurance companies, brokers, or agents. We're funded primarily from the federal government. Right,
and that's what makes it a great program.
Yeah, so we don't, personally, when someone calls me, first thing I tell them is don't listen to your friends, don't listen to your neighbors, and don't listen to your family. You call our office and you'll get someone who's unbiased, who is actually knowledgeable. Because people call in all the time and say, somebody told me, and that's when I have to say, is somebody me or just somebody you know? So, but we give them the best information we can. My only preference is to make sure you have the information you need to make an informed choice. I have no stake in the game other than that.
You know, I have a cousin who I've talked to, has an Advantage plan, all right? And he's going through some hoop-de-doo, and they're gonna do a hip replacement, and he had a lot of other stuff going on. And part of the process is, the part where what I want to stress here is that there was no premium with his program, and he was bragging to everybody how great that was. The only problem is now he really would like to go to a different doctor, but he can't because the doctor's out of his program. He would, he has to, every time he's going to do something, he has to get approval. Every test, every this, has to go through the insurance company. And sometimes that takes time. They don't just do it easily sometimes.
Well,
So my point is, I think it sounds good, no premium, and everything is great. But I think you really got to dig deep. How do you do that? That's the question.
well, how do you do that is by calling your local HIICAP office in New York or whatever the SHIP program is. And to highlight what you're saying, I'm going to give an example which I use frequently. People are always asking me, well, what about the Medicare Advantage? And I go through kind of what I explained before, but I use an example. Let's say you have to go to Sloan Kettering and you're in a Medicare Advantage plan. None of the Nassau County plans and almost none of the New York City plans are in their network. They rarely take Medicare Advantage. So if you want to go to Sloan Kettering, which I guess in the New York downstate area is the gold standard, they will not be in your plan.
That's a good example.
So that's what I'm saying. Hospital for Special Surgery is similar also. You want a hip replacement, a knee replacement. They're a very good hospital for that. That's what they specialize in. If you're in a Medicare Advantage plan, you may not be able to go there.
Well, interesting you bring that one up. My wife had a knee replacement and at Hospital for Special Surgery, and we live in Nassau County, and we never had a stitch of hassle because I'm a Medigap plan N, which you suggested, which is a great suggestion. But I can only imagine what we would have to have gone through if we didn't know. If we went to an Advantage plan because there's no premium, and all of a sudden we find out, no, you can't go there. You have to go wherever.
Now, most hospitals in Nassau County are members or are in the network for the Nassau Medicare Advantage plans. And I'm not disparaging them by any stretch of the imagination, but I was just using those hospitals as an example. But if you want to go to NYU Langone, in Nassau County, and they seem to be ubiquitous, you can
Barry,
do that.
we actually have to take a quick break. I'm sorry. We'll be right back. You're listening to Project Independence and You on 88.1 FM and WCWP.org. We'll be right back with Barry Klitsberg talking about Medicare 2023 updates and open enrollment.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence and You on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto, Lohse, and Kristina Lou. And our guest today is Barry Klitsberg, and we're talking to him about Medicare 2023 updates, open enrollment, and any other questions that come to mind. So I do have a question, and on Long Island, and I'm sure a lot of places across the country, we have a lot of government employees. We have, villages, we have schools and police, and a lot of people that are on government insurance, which a lot of us are lucky enough to have into retirement. So I always get a little bit confused. I still have a way to go, a little, till Medicare enrollment days, but a lot of people asked me about it because they knew you were coming on. And what does it mean? We believe, and this is something that we would ask you about, is that your empire or your government insurance is your primary and your Medicare then would be your secondary. Like, how does that work?
That's a great question, and I get that often. If you are working, like I said, Medicare is secondary, so you may not take it. But once you retire, Medicare becomes primary. If you are fortunate enough to have worked for any level of government that offers a retirement health benefit, that will supplement your Medicare. So
Okay.
if you're a county or a state employee and you have what's called the NICHIP program,
Mm-hmm.
right, they supplement Medicare. Now, depending on the package that your county or union negotiates with the insurers, that will determine your benefits. In most cases, with the NICHIP program, Medicare is primary, and NICHIP then pays its share of your Medicare cost share, the 20% or your hospital deductible. NICHIP can cover all or part of that. But Medicare is primary. NICHIP is your supplement. And NICHIP also, because it offers prescription coverage, is your Part D plan, because it's what's called creditable coverage, or the equivalent to Medicare Part D. And you would get a letter every year from your plan telling you this prescription coverage is the creditable coverage or the equivalent to Medicare or equal to Medicare. So you don't need a Part D plan.
Okay.
And what I tell people also is, if you're lucky enough to have a retirement benefit for healthcare to supplement Medicare, and you're thinking of switching to one of the Medicare plans, the Medicare Advantage plans, because Joe Namath was a better quarterback than he is a pitchman. If you're thinking about doing these because they're selling you all these wonderful things, think long and hard. Because if you take one of those plans and you drop your retirement plan, very good likelihood that you will not be able to get it back when you realize what a mistake you made.
So when you, with Medicare, when you talked about Medicare C, when you choose, do people not need to do that then? They can utilize their NICHIP. I mean, for the most part, I know
Right.
that you have to negotiate your union or
Right.
has different negotiations, but you would still be able to go to all your own doctors that you've continued with prior to retirement.
In most cases, yes. Again, if it's a NICHIP, I don't know if they have a managed care plan, because usually it just supplements Medicare.
Right.
So if you have a plan that supplements Medicare, when you turn 65 and you go on Medicare, then you should, I tell people, call your plan, just inform them that your Medicare starts whatever day. So this way they have it on record.
Mm-hmm.
And Medicare, when you go to a doctor, the first thing they ask you always is, what's your insurance? You're going to say, well, here's my Medicare card, my primary, and this is my NICHIP card as my supplement. When Medicare gets the information, they will automatically forward your claims information from Medicare to NICHIP for them to pay their portion.
Okay, good to know.
Yeah. NICHIP is a very good benefit. I did an event out in Port Washington yesterday, and a lot of people were in that boat. So
Right.
It's pretty common to get this question.
Right. Yeah, I can imagine, because there's a lot of employees at on Long Island.
And the federal employees also, they have some different
Yeah.
wrinkles. I mean, I'm a retired federal worker, and I have the federal employee plan, and I pay a lot more. But between that, my Medicare and that, except for my prescription copays, I never get a bill from my doctors.
I'm retired from the Mars Corporation. And what the Mars Corporation did initially, they had a supplemental plan that you would get, but then they decided they really didn't want to be in the insurance business, that they're going to give you X thousands a year to offset the cost. But you have to go through a company that manages that for them. And all changes or anything you do goes through this outfit. In this case, called via benefits.
I've seen cases like that, and it's totally legitimate.
Yeah, it is. But if you don't go through them, you mess up your benefit from the company.
Right.
Because they manage the funding. And And if you decide, no, I'm not going to go through them, you're paying a big price.
Right. There are a lot of unintended consequences, and this is an example. And I tell people, when I talk to people, I really have to go into the weeds to get all the details, because most people wouldn't think of telling me this. So if they say, well, I want to switch my Medigap plan, and I go through the regular Medicare rules, what they can do, if there are time restrictions or whatever. But sometimes I have to ask them, is there anything else about your retirement that I need to know before I make a suggestion?
Well, the old saying, the devil is in the details, is
That's
very,
right.
very true to this.
Absolutely. No, it's true. And I mean, sometimes I feel like I should have gone to dental school, because it's like pulling teeth to get the information.
Yeah, you're right.
Yeah.
Now, one of the questions I had has nothing to do with this, but this just recently came up. And we know there's going to be changes in the drug world in 2025. It's too early really to talk about what is that going to mean as far as Part D goes. I think there'll be some changes there. But one of the things that came up recently, and I use this medication as an example, a pre-diabetic medication called Mounjaro. And it turns out that this medication would cost this friend of mine, the same guy in Connecticut, $980 for 1 month supply. And they tell you need a 3-month supply. Now, the only thing is, there are savings coupons available everywhere, except if you are in Medicare, you cannot take advantage of those savings plans.
Most of the plans don't work with Medicare. Now, I tell people,
they discriminate against Medicare, basically.
Because it's not just Medicare, it's any government insurance.
Oh,
so
really?
what I tell people is, if you go into a pharmacy and you want to get that prescription, don't use your prescription coverage. And it's important to remember also that these cards, these discount programs, are not insurance. So you can't not take Medicare Part D because you're using this card, and later on take Part D without having a late enrollment penalty. So I always tell people, you can use that, but be careful, because if you don't take your insurance, you might have a problem. Now, for people in New York State, if they have these expensive prescriptions, I always recommend that people enroll in the New York State EPIC program, the Elderly Pharmaceutical Insurance Coverage, which is a state program, and many states have something similar for seniors, where they can get assistance with their drug costs. In the New York State, for an individual, the income limit is $75,000, and for a couple, it's $100,000. So it's not just for low-income folks. People with low and moderate income can apply for this. Depending on your income, if you have a deductible, it's a sliding scale. For an individual, if your income is under $20,000, you're going to pay a very small premium, and your coverage starts immediately. And if it's an EPIC covered drug, which most are, if you're eligible for the EPIC benefits, you don't pay more than $20 a prescription. So you can really save a lot of money with EPIC. And I love the program, even if you have income that's on the higher end. If you're taking an expensive drug, you would hit your EPIC deductible in a couple of months, and then $20 a prescription.
Well, like I've had, we've talked about this on our show before. A lot of times you get a medication and it comes back and it tells you, oh, it's $180. So then I go on Goodrx, and Goodrx says it's $25 with a coupon in the same drugstore.
Right.
I don't understand the whole program, but I use the coupon instead of my Part D insurance.
That's exactly what I was saying. You use that instead, but
right.
You keep your Part D insurance for your other drugs.
Yeah. I mean, the logic behind that is very hard for me to understand. I don't get it, but I guess I don't have to get it. How does Goodrx make money?
I can't answer that.
Yeah.
because Goodrx doesn't return my calls.
Oh, really?
When I call, I said, look, I have a question about this. And they said, well, that's just the way the program works. So they don't tell me. And all I tell people is you have options besides your Medicare plan. So keep your plan, but use the discounts when it's appropriate.
Yeah, and they're big. I mean, some of them are very big.
Yeah. And again, Epic is another way to help save money.
And to kind of go back to one of the things you were talking about before, with how you may not be able to go to the hospitals that you want to go to if you choose one of is it the HMOs?
The HMOs or the PPOs. The PPOs, you go. You just pay more.
So there's kind of I have been in the healthcare field in my prior life, and every practice and hospital that I've worked for, it's always has, you always think of doctors having to apply to get on the panel for health insurance, whatever it was back then, Oxford, Aetna, all those different things we used to have to apply and send in all their DEA forms and whatever they needed. Medicare, does every doctor have to accept Medicare?
No. Now, there are three levels of doctor participation. A participating doctor is a doctor who agrees upfront to accept assignment on all Medicare patients, which that means they agree to accept the Medicare approved charge as payment in full. Medicare pays 80% of the approved charge. You're responsible for 20%. This is in the traditional program. And about 90% of all claims for Medicare are assigned claims, which means the doctor sends in the bill. They can bill you the 20% unless you have other insurance, but they're not going to bill you up front for the full amount. The non-participating doctors are in the program, but they have not agreed to accept assignment for all patients. They can accept assignment, or they don't have to, and they can bill you at the time of service. They still submit the claim, but Medicare will reimburse you directly 80% of the approved charge.
Oh, so Medicare will reimburse the individual
if the doctor doesn't participate or doesn't accept assignment. Right. Now, some doctors can take assignment, or they don't have to. So let's say you've been seeing this doctor for 20 years. You have a long-standing relationship. He's not a participating doctor, but he says, you know what, for you, because I've been seeing you for so long, as a courtesy, I'll accept assignment and just bill you the 20% or your supplement. Right? And they can't charge whatever they want. Even if they don't participate, they still have a limiting charge, the maximum they could bill you for your services. Now, the third type of, I'm sorry?
Who decides what this maximum is? I mean, is there a negotiation?
Medicare has a fee schedule.
Right.
And it's different for each location, each zip code usually, sometimes based on the cost of the medical practice in that area. That's one of the factors that goes into it. So a Park Avenue doctor providing the same service as a doctor out in Sayville on a side street, because of their location and their rent, things like that, malpractice insurance, all of those factors are built into the reimbursement. So it's a fee schedule. And for most services, if they don't accept assignment, it's 5% more than the Medicare approved amount. For certain office visits or house calls, it might be 15%. So they just can't charge you whatever they want. And Medicare will still reimburse 80% of the schedule. Now, going back to the question about the third type of doctor, these are doctors that have opted out of the program completely. They do not accept Medicare. They will not bill you. They will not bill Medicare for services. If they do, Medicare will deny the claim. And if you submit the claim, it will be denied also, because these doctors have opted out of the program completely. And when you go to see these doctors, and it's a small amount, usually super specialists or some mental health practitioners, you sign what's called a private contract. And this contract is very specific. It states, I'm not in the program. I will not bill Medicare for services. They will not pay me. If you submit a claim to Medicare for my services, they will not pay you either. And I can bill you whatever you want, and you have to pay that. And because it's private contracting, you sign up front that you accept this, and they both, you and the doctor has to sign that. That's why it's called a contract, stating that you agree to use that provider for the services, and they can bill you whatever they want. It's a very small number of doctors, like I said, super specialists, or a lot of mental health doctors, because they don't have a large Medicare practice and they don't want to be bothered with the paperwork. So those are the three kinds of doctors.
So Medigap wouldn't apply either.
If Medicare denies the claim, Medigap will also deny it.
Right.
Because Medicare will submit the information to the Medigap provider, and they will say, well, Medicare denied this, so we can't pay either.
Okay, we have to take a quick break. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We will be right back with Barry Klitsberg talking about Medicare 2023 updates and open enrollment.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I am Rebecca Miller, along with Otto, Lohse, Kristina, Lou, and of course Dan Cox, who's running the show behind the scenes, always making us look really good. We're talking to Barry Klitsberg, who is an assistant program coordinator at Nassau County HIICAP program, and we're just shooting questions at you, and you just seem to know everything. So it's been most informative. But, you know, I don't want us to miss any Medicare 2023 updates or open enrollment. So if there are things that we, as we're now in the last segment of the show, I just want to make sure that we cover like the most important things, the points that are most important for open enrollment.
Thank you. I was going to lead into that anyway. The Medicare open enrollment season starts tomorrow, October 15th through December 7th. If you go onto the Medicare website today, you can get all the information about the plans for next year. But if you want to enroll, you have to wait until tomorrow, because on the same website, a new box is going to magically appear at 12:01 to enroll. So if you want to enroll in one of the plans, either it's a prescription plan or a Medicare Advantage plan, you could do it starting tomorrow. You can get your information in advance, but tomorrow the opportunity starts to change your drug plan or your Medicare Advantage plan. Or if you want to drop your, I'm sorry,
go ahead. I have a question. Is there a maximum amount of people that can enroll in certain plans? So like people, I don't want people to panic if they can't get on tomorrow and they get locked out for some reason. Is there ever a time where, oh, I'm sorry, this HMO or PPO or whatever they're enrolling for is full?
No, there's no limit on how many people can enroll in a plan. So that we can put that to rest. Now, if you're in a Medicare Advantage plan and you want to go back to Medicare, you can do that also very easily. Just by signing up for a drug plan, it will take you out of your Advantage plan. And if you are in a Medicare Advantage plan and for whatever reason, you don't make a change by December 7th, there's another Medicare Advantage open enrollment season from January through the end of March. So you have 3 months to switch your Advantage plan or to drop your Advantage plan and go back to Medicare. You can't sign up for a new plan if you haven't been in one. But if you're in a Medicare Advantage plan, you could switch or drop it. One other thing that I want to stress is if you're in a Medigap plan, in New York State, there's continuous open enrollment. There's no open enrollment season for that. So if you're in a Medigap plan, like you have Plan N or Plan G, and you want to switch for whatever reason, let's say your healthcare needs change and you need more extensive coverage, you can do that any month in New York, and it's effective the first day of the following month. So these are some critical timeframes that I wanted to make sure I got through to everybody. The other thing is, I've been getting a ton of mail from all of the insurance companies, and I'm in the federal plan, so I don't need any of them, but I'm still getting marketing material every day. The things that people really should read are mail from Medicare, mail from their current plan, and mail from Social Security, because that is official and that will give you good information about what's happening starting January. Your Medicare plan sent you a notice of update for next year, and Medicare sent out the Medicare and You book, and they will be sending out other letters, and Social Security will be sending out the notice of award changes for next year. So those are things that people should read. If you get other mail, you can read it. Maybe there's something in there of interest, or you can, line your bird cage with it or wrap fish with it. That's up to you. But the stuff from the official source where you have your coverage, that really you should look at. And if there are questions, call my office.
Yeah, one of the things that I read that really hit me is that, and I'm not knocking Medicare Advantage, all right? It fits for some people, but Medicare Advantage is a privately run version of the government's Medicare program. So what that tells me is that a lot of the material that comes out and people hawking all these great programs on TV and all the marketing flyers you get, these are all people really trying to sell you something. And they may be good, but they are trying to sell you something. So you really have to read these things, I think, with the understanding that these are marketing materials of people trying to sell you something.
That's absolutely correct. I mean, Medicare contracts with these companies to provide services. But if you're thinking about a Medicare Advantage plan, it's really important that you get all the information. Don't just go to a diner and get a cup of coffee and a muffin and listen to a presentation, because like you say, they're trying to sell you something. And there are many agents and brokers out there that are reputable and honorable and really want to try to sell you the product that works for you. But again, they're trying to sell you something. And some agents may not be so reputable. So keep that in mind.
Right.
So, Otto, go ahead. I'm sorry.
No, well, you talked about Epic, which kind of rang my bell a little bit here. The $100,000, do you happen to know what is included in that? Do they include things like IRA, or is it strictly Social Security, pension, whatever?
Social Security, pensions, earnings on the application, which is a one-pager, and it's the easiest form you'll ever fill out. It will tell you what to include, and they'll use the previous year's income. So right now they're still using 2021 because that's the information they have on your state tax return to verify. So I know some programs use, I guess it's called the MAGI, Modified Adjusted Gross Income. I'm not a tax person, so I can't tell you what goes on that line, but usually that's what's included.
Okay.
Mm-hmm. Yeah, it's a wonderful program. I mean, I had my father-in-law in there for many years, even before Part D came into effect. And then when Part D came into effect, I signed him up for a plan, an inexpensive plan. And between that and Epic, he had unbelievably good coverage.
It doesn't take much to be, if you retired 15, 20, 25 years ago, it doesn't take much to be 100,000 or under. It was a different planet as far as money is concerned.
Yeah, and many pensions don't have a cost of living adjustment, like state or federal pensions do. Many don't. So again, it's $75,000 for an individual, $100,000 for a couple, which is, most people don't fall in above that level. So it's a great program. Plus, it gives you a chance once a year to switch your plan outside of the enrollment season. So if you're an Epic and for some reason you need to switch your drug plan or your Advantage plan, because that's your drug plan, Epic gives you that once-a-year chance to switch your plan. I call it the get-out-of-jail-free card.
Now, is Epic then replaces your Part D provider?
It supplements it. It
It
doesn't
supplements
replace it. Right. So
Okay.
Medicare pays first, and your co-payment from Epic then is based on how much Epic pays for that drug. So if Medicare Part D covers most of it, and then you have an Epic picks up a small part, your co-payment could be as low as $3 with Epic, depending on the cost of the drug. So it's a really good program, and I can't stress it enough.
Okay.
Mhm. Yeah.
I guess that's it. Huh? No other changes.
No,
I'm
well,
just kidding.
no, there, I mean, again, part of the, and you alluded to this before, the not the Affordable Care, the Inflation Reduction Act. In 2025, Medicare will have the ability to negotiate prices with the pharmaceutical companies, which they never did before. But starting next year, there will be a cap on how much a senior would pay out of pocket. And the law specifies your out-of-pocket drug costs would be no more than $2,000. So again, for your friend who's paying $900 a month for that diabetes medication, that will help them a lot. All right. The donut hole is going away. Right. Plus, insulin is capped at $35 a month for seniors. So these are a couple of health-related portions of the law that really do help seniors lower their cost. And I don't want to say, and I don't want to be political saying it's a great law and whatever, but these are some things that really do impact seniors.
Now, would that take, well, like now you're applying for your drug plan for 2023. This would have an impact on where you go, wouldn't it? I mean,
You mean which company you go to?
Yeah.
I always tell people to go on the website, or we'll send you a worksheet where you enter all of your drugs and the dose and the strength and the quantity. And we'll mail you back the top 3 plans that work for the information that you submitted. So we can provide tailored information on what plan works best.
Right. But the cost of some of these drugs in next year could be dramatically impacted to us seniors.
Absolutely. That was the purpose of the law. And that goes into effect in 2023.
Oh, I didn't know that. I thought that didn't kick in until 25.
That's the negotiation.
Oh, okay. Well,
Yeah. But the caps are going to go into effect in January.
oh, well. Okay.
So
Barry,
the information, I'm sorry, go ahead.
I was going to just get off that a little bit, because one of the questions someone wanted me to ask about is, so we get older, people living longer, sometimes we become widowed, you're alone. You may require assistance at home, health aides, things like that. Is there something that we should look to with Medicare for home health services at all?
I would love to be able to say yes, but unfortunately, Medicare doesn't cover long-term care, either in a facility or at home. They cover skilled care at home. So if you need physical therapy, speech therapy, or a skilled nurse or occupational therapy, Medicare will cover that. But if you need an aid, unfortunately, Medicare cannot cover that. But there are other programs that might be able to. I know that there's a New York State program called HIICAP, Expanded in-home services for the elderly. I'm sure Kristina is familiar with that, where people can expanded in-home services for the elderly program, EISCP, because again, dealing with the government, we have to learn all the acronyms. So the ISEP can help seniors with home care. It's you can't get it if you're on Medicaid, which is another source of home care, for long-term care. But ISEP can help seniors who are above the Medicaid limit, but still need this care at home. So again, if you call my office, I can refer you to one of our ISEP people, and they can contact you and work with you to get care at home that you might need. This is not skilled care.
give us that. I'm going to give you the number again. So if you want to speak with Barry about anything he's talking about today, anything related to Medicare, it's 516-485-3754. So you can also call 311 and ask to speak with Kristina or I, and we'll give you that number as well.
Sure. And again, the HIICAP program has a sliding scale of the fee based on income, but it is a low fee. So, and now Family and Children's Association also does other services, like we have a tax preparation assistance, a bill payer program where somebody can come and help you organize your checkbook and make sure things are paid on time. They have the linkage program, a whole Alzheimer's programs. There are a whole slew of senior programs that we can work with you on to help, maintain your quality of life and keep you involved in the community.
Which is right up the alley of Project Independence, because that's the mission, really.
Right.
I know I know that we've worked with Project Independence in the past at health fairs and presentations.
No, I know.
They do really good work.
Yeah, so do you.
Thank you.
It's very beneficial. I mean,
Right.
talking big, a lot of money to a lot of people, and you're talking about a quality of your health care and what you can and can't do. If you have the wrong insurance, you could have a problem.
Right. And there are low-income programs for seniors, which will also pay your Medicare Part B premium. That's the Medicare Savings Program, that $164.90, that's going to come out of your check. If your income is low enough, they'll pay that for you, plus get you extra help, which will lower your prescription drugs dramatically. So these are some other programs we can help seniors with.
Barry, what's the best way for someone who's got the insurance, they're all set up, and they all of a sudden realize that they're no longer getting the brand medication, they're getting a generic, and they need to talk to somebody over at Medicare. What's the best way? Because it's overwhelming. We have super seniors. We have people 80s, 90s, and they'll, instead of asking questions, may just not want to even call because they're so overwhelmed with any change. So what's the best way to reach out to Medicare?
Well, you could call 1-800-Medicare. But if you have a problem with, it's called a tier exception. Let's say your generic is tier 1, which is the lowest cost. But for medical reasons, your doctor and you decide you need the brand name. All right. There may be some medical reasons. So even though the basic medicine is the same, the binders and the tablet, you may have an allergic reaction to. And I've seen this. So the doctor says, no, you can't take the generic. And if the plan says, all right, the brand name is tier 4, you can request an exception to lower the tier. And the doctors have billing people that do this, so they can request that from the plan, or a person can call 1-800-Medicare or the Medicare Rights Center in Manhattan, and they will help with every appeal. They're a very good organization, also part of the HIICAP program. So, but again, to simplify matters, and instead of giving out tons of numbers, call me.
Okay.
If a person has a problem, they can call me. If I think that they would do better with another organization, I will gladly give them that information so they can contact them directly, and also tell them what they need to have available when they call. Because a lot of times people call, and I'm sure you've all seen this, people call for help, and you ask them a question. Oh, I didn't know you were going to ask that. Let me get my papers. So I'll tell them what they need to know before they call, so they're ready.
You're prepped
You know
up.
what? I'm sorry, but you just raised something that hit my head. Tier 4 drugs are where most people, or above, if there's such a thing, where people run into trouble. Now, in 2023, the maximum out of pocket is $2,000. Does that also apply to the tier 4 drugs?
It should,
Right.
because those are the expensive drugs,
Right.
which was the intent of the program. The intent of the law was to cap seniors' payments to $2,000.
Right. So that's huge.
It really can be. Those
Yeah.
tier 4 drugs, also the insulin benefit, capping it at $35 can be phenomenal. Put a lot more money in seniors' pockets, or people who are on Medicare because of a disability or some other condition. But absolutely, this will really save people a lot of money.
Now, how do you think that's going to work? Like the Alzheimer's drug, that Aduhelm,
Yeah.
which is like $1,000 or $12,000, pick a number. Would that fit into this kind of thing?
It should. But again, I think that drug is not self-administered. So it's covered by Part B. Medicare Part B covers drugs that you cannot self-administer. You can self-administer insulin, tablets, capsules, creams.
Okay.
But if you need an infusion, it's covered under Part B. And like I mentioned, that was one of the reasons that the estimates of the Part B cost was going to go up so much. Well, they had to recalculate, and that's why the premiums are going down, because there was thought that a lot of seniors would get that drug and it would be very expensive. Wasn't quite as expensive as preliminary thoughts were. Plus, not as many people were using it as thought. So
Well,
that's
Barry, we actually, I want to say that most program this phone number into your phone, 516-485-3754. We actually have come to the end of the show, Barry. I know we'll have you back. You're always accessible to us. We're so grateful for that. Thank you for all this information on the Medicare 2023 updates and open enrollment. You've been listening to Project Independence in You on 88.1 FM and WCWP.org.